My name is Megan Griffith, and this is a presentation about Parkinson's disease. It's given descriptors like complex, progressive, neurodegenerative, and is only second in commonality to Alzheimer's disease, another neurodegenerative disease. Currently, there are 1 million Americans diagnosed with Parkinson's disease, and that number is added to annually by about 60,000 people. Symptoms for Parkinson's disease can be broken into one of two categories: motor and non-motor. Motor symptoms are going to include things like tremors in the hands or the head and neck region, most commonly and most obviously. It can also include rigidity and postural instability, but that only occurs in some patients and only with progression of the disease, not at first. Non-motor symptoms are going to include things like loss of smell, constipation, urinary dysfunction, sleep disorders, things like that. Those can also be associated with lots of other diseases and disorders, or chalked up to just everyday life like diet, exercise, sleep habits, different things like that. What we do see though is that as the disease progresses, the severity of those symptoms progresses as well. And that could mean the addition of symptoms, but it definitely means that those symptoms that do exist are getting worse. In terms of development, research shows that the non-motor symptoms actually occur first and then are followed by motor symptoms. In some cases, the non-motor symptoms can present years or even decades before those motor symptoms occur. That can make diagnosis really difficult because, again, these non-motor symptoms can be attributed to other diseases or disorders, or even side effects of other medications, or a number of things, changes in habit, stuff like that. However, diagnosis does happen on a clinical basis. So if a patient presents two of the three most common symptoms, they are diagnosed with probable Parkinson's disease. In order for a diagnosis to be definitive, they would have to have histopathological assessment done, and that's where they're going to start looking for the existence or presence of specific Lewy bodies in the alpha synuclein. In terms of general physiology, what's happening when someone has Parkinson's disease is that there is a significant decrease in the dopaminergic innervation of several different areas. Generally in the olfactory bulb first, and that's where we see that loss of smell being one of those very early non-motor symptoms that occurs. But then from there, it would move into the central nervous system in the brainstem region and in those structures. And that's where we're going to see some of those other symptoms, including motor symptoms, coming into play. Parkinson's disease, however, is highly heterogeneous, meaning that it impacts different places in different ways. So that can make diagnosis tricky, but it also makes treatment really difficult. Some of the long-term complications associated with Parkinson's disease include not just worsening symptoms or the presence of additional symptoms over time, but also things like that postural instability that can occur in some patients over time, but freezing of gait, and that along with postural instability can work together or even alone as something that increases the likelihood of falls, which then increases the likelihood of fractures and breaks of major bones within the skeletal system. And considering that Parkinson's disease happens generally to the older population, that makes recovery from those things really difficult to achieve and very worrisome. Long-term complications can also include dementia. Again, this is a neurodegenerative disease. Dementia is a neurodegenerative disease. It can be easily seen how these things might be tied together. It can also contribute to hallucinations over time. Some interesting factors that were thought at one time to possibly contribute to Parkinson's disease now fall into one of three categories. The first is for a negative correlation. So as these factors increase, the likelihood of a Parkinson's diagnosis actually would go down. It would actually decrease. And that includes cigarette smoking and caffeine consumption. Nicotine and caffeine actually both interact with the dopaminergic innervation within these cells as a neuroprotective factor, which is really interesting. So as those things increase, nicotine and caffeine, likelihood of degeneration on the cellular level is actually decreasing in terms of how Parkinson's disease would manifest. The positive correlation category, so these things increase, Parkinson's likelihood would increase as well. we see herbicide and pesticide use. The chemicals used in these are actually very commonly associated with this, and they're actually leading to some other studies trying to connect some other factors like farming to Parkinson's, living in a rural area, drinking from well water, heavy metal exposure, some of these things. But that is just, again, it's just a positive correlation, and that hasn't been proven yet, and those are still under research and being studied. Finally, we have the unconfirmed category, and the only item here so far is genetics. In fact, only 10 to 15% of patients with Parkinson's disease can connect that back to some kind of family tie. So there's a very low unconfirmed genetic component there. Finally, we get to treatment options. Depending on what kind of patient you have, you've got different options. So the tremor dominant is going to be treated for dopamine issues. The non-tremor dominant is going to be treated for other issues, including things like dementia or depression. And that is Parkinson's disease.